Good morning. You are listening to part one of a two-part series on coping strategies for healthcare workers working with refugees and other displaced persons. I am Saida Akila Ali from the Center for Global Health at University of Illinois at Chicago. We partner with MedGlobal at several sites across the world. Across the world, healthcare workers are the front lines of taking care of patients. They might not have enough equipment. They are worried about getting exposed to coronavirus. They are worried about their families. Despite all this, they are trying to support their patients. This is an extraordinarily difficult position to be in. We thank you for your work that you do in the front lines. We want to offer some strategies that might help you take care of yourself so that you can be most helpful to your patients. This is the first of two webinars on stress management. During the 2020 COVID-19 outbreak, this webinar will focus on recognizing stress and discuss a few strategies to cope with stress. The second webinar in this series will continue discussing a few additional strategies. At first, we're going to talk about recognizing stress. The pandemic, like any other disasters, can increase stress or anxiety amongst healthcare professionals and in our patients. It is essential to recognize stress in order to manage it. Stress is defined as a mental or emotional strain caused by adverse or challenging circumstances. Some stress is caused by one-time events that cause a lot of emotional strain, like the unexpected passing of a friend or a family member. Other kinds of stress are caused by dealing with challenging times for a long period, like providing healthcare during a pandemic. Stress affects people physically and emotionally, and it affects each person differently. Each person's response to stress is individual. It also affects our thinking, mood, and behavior. Some people show only physical signs of stress, such as muscular tension, headaches, or sleep problems. Others have trouble concentrating or become irritable, anxious, depressed, or feel numb. Still others may pace or bite their nails. Each person's response to stress is individual. Being aware of your own signs of stress can help, because once you realize that you're under stress, you can start to do something about it. Now, we will discuss a few ways to identify stress amongst adults. Signs of stress in adults can be weight loss or gain, pain in different parts of the body like headaches, muscle spasms, stomachache, feeling tired, so feeling reduced energy, sleeping problems such as having frequent nightmares or having a difficulty falling asleep. They can also include changes in concentration and have an inability to concentrate. You can experience lapses in your memory. You can feel socially withdrawn, so you do not want to speak with or socialize with others. This can also make you feel easily distracted, angry, getting annoyed easily, or it can change your communication with others. Pay attention to yourself and your reactions. That is one way to recognize what feeling stressed looks like for you. Now we're going to move on to talk about managing stress for individuals. We will share some strategies. Coping mechanisms like these enable us to adjust to stressful events and at the same time maintain our emotional well-being. Continuous stress can get in the way of us being able to do things we need to do in our daily lives. In this case, stress levels stay elevated for a long time and it can take a toll on your health. So what can you do to help yourself when you live in a state of constant stress? Here are some suggestions. First, you have to make sure that you are actively relaxing your muscles. These can get very tense when we are stressed. Tense muscles can be the reason for pains and aches in the body, hence relaxing them would also make you feel better. Secondly, you can use positive self-talk. You can say things like, "This is hard, but I can do it." Be active, exercise, go for a walk, go visit your friends or relatives. Whatever you prefer to do it. Don't stay inactive. Listen to music, make art, try to do something new, such as watching a sunset or learning a new skill. Write. You can try writing in a journal. Write about your feelings and the thoughts that are going by. This can help you think through things. Finding a community, consciously building your network of friends, family, and community. They will be your most powerful allies in achieving long-time health. Participate in a religious or spiritual activity. Meditate or do your prayers. Sleeping well. Lack of sleep increases stress hormones. Take a nap if you have missed sleep. Now we're going to talk about reducing misinformation as a strategy for managing stress for us individually. Researchers have shown that when people read a lot about a certain kind of news, especially pandemics on social media, their perception of that risk increases. So we suggest limiting time on social media. Don't focus too much on media of any kind to protect your mental health. Managing stress as soon as possible prevents long-term troubles. Not dealing with stress can make individuals more likely to have poor health, increased pain, feeling depressed or anxious, and may lead to more family conflicts. Feeling a lack of control adds to stress. Later on, in the family section of our webinar, we will talk more about this. Now, we're going to discuss one specific strategy for individuals to reduce stress and to cope with it: slow breathing. When we feel stressed or anxious, our natural physical response is for our breathing to quicken, to take place in the chest and become shallower. You might notice the effects of this change in breathing, such as through headaches, chest pain, tiredness, or dizziness. By slowing the rate of breathing and taking breaths from the stomach instead of the chest, we are sending a message to our brain that we are relaxed and calm. The brain then sends this message to the rest of the body, like the muscles and the heart, and then the whole body slowly begins to relax. So before we start, find the most quiet place where you can do this exercise. We want to relax your body a bit. Shake out your arms and legs and then let them go floppy and loose. Roll your shoulders back and gently move your head from side to side. Now, placing your hands on your stomach, we want you to imagine you have a balloon in your stomach, and when you breathe in, you are going to blow that balloon up, so your stomach will expand. It is very important to keep in mind that we need to wait a bit before starting to deflate the balloon in our stomach. Once you are ready, then begin to breathe out, so that the air in the balloon will also go out and hence your stomach will flatten. Let's do this for 5 times. 1. Breathe in. Feel the balloon in stomach and slowly breathe out till stomach is flat. 2. Breathe in. Feel the balloon in stomach and slowly breathe out till stomach is flat. 3. Breathe in. Feel the balloon in stomach and slowly breathe out till stomach is flat. 4. Breathe in. Feel the balloon in stomach and slowly breathe out till stomach is flat. 5. Breathe in. Feel the balloon in stomach and slowly breathe out till stomach is flat. Remember, we start by breathing out until the air is out, then breathe in. If you can, try and breathe in through your nose and then breathe out through your mouth. Great. Now the second step is to slow the rate of your breathing down. Most people breathe at 12 breaths per minute when in a relaxed state. We will use a basic counting strategy to help you slow your breath. 3 seconds to breathe in, 3 seconds to hold your breath, and 3 seconds to breathe out. 1, breathe in through your nose and mouth. Feel the balloon in stomach and slowly breathe out through the nose and mouth till stomach is flat. 2, breathe in through nose and mouth. Feel the balloon in stomach and slowly breathe out through nose and mouth till stomach is flat. 3, breathe in through nose and mouth. Feel the balloon in stomach and slowly breathe out through nose and mouth till stomach is flat. 4, breathe in through nose and mouth. Feel the balloon in stomach and slowly breathe through nose and mouth till stomach is flat. 5, breathe in through nose and mouth. Feel the balloon in stomach and slowly breathe out through nose and mouth till stomach is flat. 6, breathe in through nose and mouth. Feel the balloon in stomach and slowly breathe out through nose and mouth till stomach is flat. 7, breathe in through nose and mouth. Feel the balloon in stomach and slowly breathe out through nose and mouth till stomach is flat. 8, breathe in through the nose and mouth. Feel the balloon in stomach and slowly breathe out through nose and mouth till stomach is flat. 9, breathe in through nose and mouth. Feel the balloon in stomach and slowly breathe out through nose and mouth till stomach is flat. 10, breathe in through nose and mouth. Feel the balloon in stomach and slowly breathe out through nose and mouth till stomach is flat. 11, breathe in through nose and mouth. Feel the balloon in stomach and slowly breathe out through nose and mouth till stomach is flat. 12, breathe in through nose and mouth. Feel the balloon in stomach and slowly breathe out through nose and mouth till stomach is flat. Good job. Try to practice this strategy regularly, and especially when you are feeling anxious or stressed, because it helps us slow down our breathing. Now, we will talk about a few quick strategies for managing stress in your family. In the second part of our webinar, you will learn more strategies about yourself and more strategies for your families. The first strategy that we will discuss about families is preparedness. Preparedness can be an active coping skill which reduces stress and anxiety. I'm sure at this moment you have a lot of questions like, what if a family member or a colleague or a neighbor catches COVID-19? What if any of the staff get infected? Make plans for what will happen if someone in the home or the city becomes ill and is led to quarantine. This can be addressed by contingency plans that you can discuss with your family members and colleagues and agree on. Often, when people know what to do, it significantly reduces the anxiety and stress they feel due to the pandemic. So we're going to talk about this active coping skill and making a plan. First, meet with the people who needs to be included in your plan. Include all the household members and sit down to discuss what to do to limit exposure to COVID-19 and what to do if the outbreak occurs in your community and in your family. Discuss what the needs of each person will be. Set some ground rules to communicate effectively. We will be talking more about ground rules for communication in the second webinar. Prepare for a range of scenarios. As a family, define the problem, then brainstorm ways to solve or reduce the problem. Make a list of helpful strategies. Combine the strategies to make an action plan for the family. You can talk about the facts of how COVID-19 is transmitted with your family. Remind everyone in your household of the importance of practicing everyday preventative actions that can help prevent the spread of respiratory illnesses. Avoid close contact with people who are sick. Stay at home when you are sick, except to get medical care. Cover your coughs and sneezes with a tissue. Clean frequently touched surfaces and objects daily. For example, tables, countertops, light switches, doorknobs, and cabinet handles, using a regular household detergent and water. If surfaces are dirty, they should be cleaned using a detergent and water prior to any kind of disinfection. Wash your hands using soap and water for at least 20 seconds, especially after going to the bathroom, before eating, and after blowing your nose, coughing, or sneezing. If soap and water are not readily available, use a hand sanitizer that contains at least 60% alcohol. Always wash your hands with soap and water if they are visibly dirty. As you are discussing plans with your family, choose a room in your home that can be used to separate a sick household member from those who are healthy. Identify a separate bathroom for the sick person to use if possible. Plan to clean these rooms as needed if someone becomes sick. Plan for ways to care for those who might be at greater risk for serious complications. From the data that are available for COVID-19 patients and from data on related coronaviruses such as the SARS and MERS, it is possible that older adults and persons who have underlying chronic medical conditions may be at risk for more serious complications. When you sit down with your family, create an emergency contact list. Ensure that everyone in your household has a current list of emergency contacts for family, friends, neighbors, healthcare providers, teachers, employers, and the local public health department. Identify 8 organizations in your community. Create a list of local organizations that you and your household can contact in the event that you need access to information, healthcare services, support, and resources. Consider including organizations that provide mental health or counseling services, food, and other supplies. Talk with your neighbors about emergency planning. If your neighbor has a website or social media page, consider joining it to maintain access to neighbors' information and resources. In addition, you can put together a kit with supplies to last your family for 3 to 5 days. Some of the supplies can include water, food, dry foods, and fluids with electrolytes. You can include regular medications and any equipment, such as a thermometer. You can include medicals for a fever, such as acetaminophen, which is paracetamol, or ibuprofen, and antidiarrheal medication. You can include hygiene supplies such as soap and water, alcohol-based hand wash, tissues, toilet paper, and disposable diapers if necessary. You can also include general supplies such as a flashlight or torch and batteries, portable radio, and garbage bags. Thank you for listening to us. Here is our contact information, and stay tuned for part 2 of the webinar.